Hello everyone, Dr. Suneel Dhand, internal medicine physician. Welcome to another video. I want to share with you a very interesting development over the last few days, which proves a point that elections do have consequences. As cynical as people may get nowadays, elections really do matter and they really can change things. And this was a tweet which was put out by the commissioner of the FDA a few days after the US election result and the nomination of Robert F. Kennedy Jr. as the Health and Human Services Secretary. Take a look at this. So here we have the tweet from Dr. Robert Califf. As the saying goes, you are what you eat. And unfortunately, the food we eat is only solidifying America's tragic title. We have the lowest life expectancy among large high-income countries. Read more about the steps FDA is taking to help. And then there is a link to the article. This was shared on Robert Califf's public Twitter feed as the official spokesperson, I suppose, for the FDA. He is the commissioner. What a development. Now, Robert Califf has been FDA commissioner for almost 3 years. And I've been following the FDA for some time in their online communication. Robert Califf has been quite relentless in pushing many drugs, in my opinion, often inappropriately. That's not his position. That shouldn't be his job duty to basically sell drugs to do the work of pharmaceutical companies. He was relentless in his push for boosters. He also pushed a drug called Paxlovid for the pandemic infection, which I'm not a huge fan of by any stretch of the imagination. I've seen lots of side effects. I personally would never take it. And he has done so with very, very little evidence. And this is fairly typical of how the FDA operates. In all the communication I've ever seen from them, I've never seen them talk about health and well-being. Maybe they put out the odd tweet over the years or the odd official communication, but I haven't seen it personally. If anyone has, feel free to let me know. But they are all in on pushing pharmaceutical products. How typical. And isn't it somewhat strange that a few days after the election result, a few days after, it looks like Robert F. Kennedy Jr. will really be part of the picture, and actually Robert Califf's boss, he suddenly, out of the blue, finds it in himself to care so much about the health and well-being of the population and actually address the number one issue facing the United States. Seems a bit suspicious to me. It's like what happened in 2021 and 2022 with the pushing of the shots. Think about this in the United States. I know this isn't the case in Europe, but in the United States, healthcare is very costly indeed. The healthcare system is absolutely atrocious, bankrupts thousands of people every year. People are very much out on their own. They often can't get treatments if they can't afford it. So you're telling me that a system which has been like that for decades suddenly cares so much out of the blue in 2021 that they want to give everybody a free shot. They're encouraging everybody to do that because they really care so much for the health and well-being of the hundreds of millions of Americans. Give me a break. Common sense tells me that there were some strings being pulled at the top, some financial incentives. The shots were not free, they were paid for by the taxpayer, and billions of dollars was changing hands. But coming back to the FDA for a moment, now I've seen them in other tweets over the years push some very unhealthy things, like chocolate-covered pizza. What makes them out of the blue want to really care about health and well-being and address the toxic food situation? Because it kind of reminds me of those World War II movies. Maybe you've seen them as well, where you know who, that group of people, suddenly started pretending to be kind when they knew the Allies were on their doorstep, when the Americans and the Brits were approaching. You know who were pretending that certain things never happened, that they were very kind and caring all along. Get out of here. Seriously, that's what this reminds me of. Because over the years, I've seen nothing but the FDA inappropriately push drugs, pharmaceutical products. Not a surprise, because almost 50% of their funding comes from drug companies. Doesn't that seem quite strange? Why would a regulatory body be funded by the very organizations, the businesses that they're supposed to be regulating? This shouldn't even be in question. Totally inappropriate, but that's the way things work. That is what we call regulatory capture. But Robert Califf now has suddenly changed his tune. And to put it mildly, let's be quite honest here, we're all adults in the room, we can all see what's happening. Robert Califf has done this because he knows, to put it bluntly, that his ass is about to be fired by the incoming administration, especially if Robert Kennedy is in charge. Or as we say in England, his ass is about to be made redundant. That's what's really going on. So really, get out of here with your fake sudden concern, your fake realization that this is the number one issue facing the United States, soaring rates of chronic disease and an absolute food catastrophe that we have on our hands. Why were you not doing your job for the last few years? Does anyone seriously believe that Robert Califf really wants to be all in on this now? But getting back to the main point, elections have consequences and change can occur. And let's hope that change really does occur. But I'm pretty sure that when it does occur, Robert Califf and his minions who are at these three-letter agencies who have done nothing but be in a revolving door with the pharmaceutical industry will not have a seat at the table. They will not be in the picture. That's all I've got to say about that. Let me know your thoughts down below. What do you think? Are you suspicious as well about the FDA commissioner suddenly putting out tweets like this? Or do you think that the people who are currently in charge really want to be reformed and understand what health and well-being is all about? Thanks everyone again. Check out the links in the description below for my website, my health programs, and my free newsletter. Hit the like button if you like this video and the subscribe button for more similar videos in the future. We will speak again very soon.